Hey, this is Dr. Nathan Thompson with Exemplify Health Center. Today's exercise is the elbow mobility. All right, so what we want to do to increase elbow mobility, and this is specifically for anyone who has any kind of pain that's going to be in the front of the forearm or off to the back or the side. So either side of the forearm is you can experience pain in both areas or actually just in one. This is also known as tennis elbow in this area, and if you're experiencing pain here or into the front of the arm, this is known as golfer's elbow. So one of the reasons why you start experiencing pain in through these areas is through repetitive trauma or through injuries. You tend to build up a lot of scar tissue in through this area, and when there's scar tissue, you start losing range of motion. And then as you start to lose range of motion, you start doing everyday activities that requires more range of motion, and you start to develop a lot of inflammation in through the bone and in through some of that muscle tissue. So what I want to go over with you is what you can do at home in order to start decreasing that scar tissue and start increasing the range of motion back into the elbow, just to help get you better a little bit faster. All right, so the first thing that we want to do is we want to do what's known as joint flossing. So we're going to be taking this band right here and we're going to be wrapping it around the elbow from the middle of the upper arm down to the middle of the forearm, and then we're going to start using this band to start flossing or start scraping some of that muscle in order to reduce that scar tissue and increase that range of motion. So with this band, the first thing that you want to do is you always want to start on the upper arm and then work your way down. So we actually want the blood to actually start to pool into the hand. So start in the upper part of the arm and then work your way down. So we're going to take this band, we're going to start in through the middle part of the arm, and we're going to overlap each section by about a half. Now each time that you go around, you'll probably need a friend to help you with this, but every time you're going around, you're just going to hold it and then tighten it so that you want this as tight as possible. Now in addition to that, you want to keep the elbow straight and not in a bent position. Now remember, make sure that you're overlapping each section so that you don't have any exposed skin. If you expose some of the skin or some of the skin starts to push its way out, you'll notice that afterwards you'll get quite a bit of bruising, and you'll also will feel it pinch. So you'll notice that each time I'm going around, I'm pulling it just a little bit tighter and then overlapping each section to make sure that we're not exposing any skin. So once we get down to the middle of the forearm, what we're going to do is we're going to go ahead and just hold it and then just wrap it around kind of loose and then put it through so that this band actually stays in place. So now that we've done that, this should feel really tight. Does it feel pretty tight, Kelly?
Yes.
All right. So the first thing that we want to do is you can do this against a person or you can actually do it against a wall. So the first thing that we're going to have Kelly do is, let's say that I'm a wall and she's going to be pushing her elbow into a fixed surface, and now she's going to actually work on flexing and trying to extend the elbow, trying to get all of that range of motion back. This is going to be a little bit tender, it's going to be a little bit painful while you're doing it, but don't worry, we're only going to be doing it for a couple of minutes. So once we actually do this for about a minute, trying to get the elbow to flex and extend, the next thing that we're going to do is we're just going to flex the arm just a little bit, and we're going to take that elbow and we're going to glide it from side to side. Okay? So now we're going to glide side to side for about 1 minute. And once we're done with that, the last thing that we're going to do is we want to actually just put our hand down onto a fixed surface, a table, a chair, the ground, and keeping our hands fixed, we want to actually rotate our arm back and forth. So just while you're keeping that hand fixed, you're taking that elbow and you're trying to rotate it as much as possible. So do this for another minute. Now, once you get done with about 3 minutes of doing this joint flossing or joint scraping, one of the things that you're going to notice is that your hand is probably going to be a little bit numb. So once you're done with that, you're going to go ahead and you're going to take that off. And so once you take it off, one of the cool things is you're going to notice a lot of blood supply start to return back into the hand. Now how this is going to help you, and you can see how we've restricted all that blood supply. So once we actually do that, you'll notice that you'll get a bunch of new blood into that area. New blood actually means new healing. So we want you to do this elbow joint flossing exercise. Do that every single day. All right, so the next thing that we want to do is we want to do a technique that's called gua sha. And gua sha actually is a joint scraping technique. And you can see here that I have a few different tools that you can use. Now you can actually get these tools on Amazon. They're relatively inexpensive, about $25. But what gua sha actually does is it helps to scrape the muscle and helps to break down some scar tissue that's actually contributing to a lot of the pain and the inflammation that you're experiencing in the forearm or in the elbow. Now, this will come with a lot of different shape tools. We actually find that the one that is shaped like this is going to work best for the forearm. So let's say that Kelly has tennis elbow and she's experiencing pain right in through here, and she'll also feel it going down into the upper part of the forearm. So I'm going to show you actually what you can do to scrape that area, and do that for about 3 to 4 minutes after you're done with your joint flossing. Now, when you're doing any kind of gua sha or any kind of scraping, you always want to have something to lubricate that area. Otherwise, you don't want to develop any kind of blisters. One of the things that we use is you can use any kind of lotion or any kind of like Deep Blue, for example, that we use. And this will just provide a little bit more lubrication in the area so that we're not irritating the skin. So for Kelly, we're just going to put just a little bit of this Deep Blue on the area. That'll provide, help these the instruments to actually start to glide across the skin. And what we're going to do is we're going to use this curved part of this instrument, and we're going to start applying some pressure, and we're going to be just scraping this area down. Now while you're doing it, you should feel almost like a grating or maybe even like a tearing sensation. You want to go into all these areas that are actually tender, and so it may be up next to the elbow and then going down some of these wrist extensors. So you notice that the Deep Blue is providing a little bit of lubrication for it. And so you can actually do this on your own. A lot of times people ask, how hard should I do it? You should do it hard enough to where it actually causes some discomfort. So you would be doing this across the top part of the forearm. If you have, for example, golfer's elbow, you would actually be doing it here and going into the forearm in through down into the middle part of the front of the forearm. Now, what you're going to notice that when you do this initially, because you are breaking up a lot of scar tissue, you may notice that you'll get some bruising. And that bruising is completely normal. It's not causing any kind of damage. And in fact, the first couple of times that you do it, you may actually see a lot of bruising that will stay there for a few days afterwards. So you're not creating any damage. The next day you can go ahead and do it again, even if there's any kind of bruising there. It just means that some of the scar tissue is breaking down, and as a result, you're actually getting some brand new blood supply into that area, which will help your overall healing. So remember, it's the joint flossing first. Do that for 3 to 4 minutes, followed by the joint scraping, also known as gua sha. And so give that a go. It should take you about 10 minutes total. Make sure you're doing that every single day.